You.
Come in.
Hello, hi, my name is Jada. I'm going to be your nurse today. I'm going to have you take a seat up on the exam bed for me. Just get some sanitizer before we get going. Alrighty, just want you to verify your name and date of birth before we get started.
Giselle Crassus of July 8th of 2000.
Alright, just going to make sure that's correct on your patient wristband. Alrighty, looks good. Do you know where you are today?
Rasmussen Hospital.
Alrighty, and do you know what today's date is?
October 29th of 2020.
Perfect. So we're going to go ahead and get started and do a head-to-toe assessment before we get started. Just want to make sure that we are aware patient is oriented and knows where she is at. Alrighty, we're just going to inspect and palpate the head. Alright, I'll have you look up. Just going to be checking the eyebrows, checking the eyelashes, eyelids. And we'll look up a little bit more. Conjuncta is pink, sclera is white. Alrighty. Just gonna go ahead and grab the pen light. I'm gonna have you stare at the bridge of my nose, or it is on my mask. Just gonna run the pen light across the eyes. Alrighty, perfect. Pupils are equal and round, also reactive to light. And do you know how many fingers I'm holding up?
2.
Alrighty. Cranial nerves 3 are intact, and then cranial 2, because she was able to count the numbers. And then we're going to do the pen light one more time. Alrighty, wings are intact. That covers cranial nerves 3, 4, and 6. Now we're just going to go ahead and check the ears. Alrighty, looks good. Check the other side, looks alright. Nothing in the ears, and then I'm basically just going to be snapping on either side. You're just going to let me know which sides you hear that on.
Left.
Alrighty.
Right.
Alright. You can tell which side those are, and then I'm going to have you look up. Just going to check the nose, check the mouth. Alrighty. Just going to get down on one knee. Normally we would have a patient bed which could rise up, therefore I wouldn't have to stand and hunch my back over. Alrighty, so you're gonna open your mouth for me. Perfect, nice and big. Puff the cheeks. You're gonna close your mouth, you're gonna puff the cheeks for me. And you're gonna smile, nice and big. Now have you swallow. Open the mouth one more time, stick the tongue out. Alrighty. Cranial nerves 9, 10, and 12 are intact. Thus patient puffing the cheeks, that is cranial nerve 7. And then we're just gonna do some other nerve testing. So I'm gonna have you hold your hands out by mine. You're gonna push my hands away. Alrighty, resistance shows cranial nerve 11. And then we'll do the shoulders. Can you shrug your shoulders while I push down? Oh, nice and up. Alrighty, cranial nerves 11 intact. And then we got the neck and trach. Midline, no JVD, no swelling or pain in the clavicle area, my lymph nodes. Alrighty. And then are you wearing a t-shirt or a sports bra underneath the sweater? Did you want to get changed into a patient gown today? Are you comfortable taking off the shirt?
I'm fine taking off the shirt.
Alrighty. We'll have you get changed into that. We're just going to go ahead and check the chest and palpate the area there. I'll let you take off your hoodie. Alrighty, and you can take a seat one more time for me. Alrighty. And then just nice and easy breaths for me. I'm gonna make sure the bell is working. Get back down on one knee again. Right, nice and easy breathing. One more time. And one more. And alright. So basically we are identifying right intercostal on the second space. That is going to be the aortic. Left side, second intercostal space, pulmonary. And then third is going to be Erb's point. Moving down to tricuspid. And then onto the left. Yeah, that's left side. Midclavicular line. Now we're just going to go ahead and flip the bell. And then we're going to be listening to that mitral. Alrighty. And tricuspid. Alright, very good. And then we're going to go ahead and have you laid down. We're going to go ahead and check the abdominal area. So you can have your head placed down here, feet down here. Ready. Now we're just gonna palpate and auscultate the area. Now you're checking the right lower quadrant. Ready. Moving up to the right upper quadrant, across to the left, and back down to lower. Then using the stethoscope, we're gonna listen for bowel sounds. Check my bell one more time. Any pain?
No.
Alrighty. And if there were any abnormalities, we would listen even longer just to make sure. Ran my stethoscope over the liver, epigastric, spleen, and suprapubic area along with the center. Verified with the patient that there is no pain. And do you remember when your last bowel movement was?
Oh, this morning.
Alrighty. Any pain? Was it solid? Was it watery?
Oh, solid.
Alrighty. And what about going to the bathroom, urinating? Any pain? Any burning?
No.
Alrighty. No possible UTIs going on?
No.
Alrighty. And since the patient is female, we're going to ask if she had her last menstrual cycle. Do you remember when your last menstrual cycle was?
2 weeks ago.
Alrighty. No chance of pregnancy?
No.
Any vaginal pain, vaginal bleeding?
No.
Alrighty. And if the patient were male, we would ask if there was any penis pain or discharge from the penial area. Alrighty. We'll have you go ahead and sit up. Oh, it's hard to breathe in this thing. Alrighty. Now we're going to just have you we're going to check out these shoulders. I'm going to go ahead and look at the elbows. We're just going to palpate, examine for any swelling, any pain in the arms going on. No. Alrighty. Now we're going to go ahead and check for any redness. Palpate the fingers. Alrighty. I'm going to have you go ahead and squeeze my hands. Alrighty. Neuro assessment is good. I'm going to check the capillary. Ready, sensory and motor is going to be identified. I'm going to go ahead and pinch one of your fingers. You're just going to tell me which side and which finger.
Right pointer.
Alright. Check here. Good, circulation. And then we'll have you go ahead and lay down one more time. I'm just going to go ahead and check out the legs. I'm just going to move this over. You ready? Any pain in the legs?
No.
Just auscultating and palpating on the legs. And we're just going to roll these up so we can check out the knees, make sure there's no swelling. Alrighty. No swelling or redness on the knees. Alrighty. Any pain in the legs or pain that radiates down the legs? Do they feel swollen at all?
No.
Alrighty. No wounds, no redness. And then we'll check out the feet. I'm just going to go ahead and take off the socks, okay? We'll check those out. Make sure there's no pedial edema going on. Palpate, no pain in the feet at all?
No.
Alrighty. Circulation check is good on the dorsalis pedis. And then along with checking the posterior tibialis. Capillary refill is good. Just going to go ahead and take out my pen one more time. We're going to run it along the foot. This is checking for Babinski. Ready? Looks good. All are negative. We'll have you sit up one more time. We're going to go ahead and check the back out. Just going to have you go ahead and lean forward for me. There we go. No pain, no discomfort?
No.
Alrighty. Just going to move the ponytail aside. Breathe nice and easy. Alrighty. Breathe nice and easy. We don't want to go over the scapular or the spine, so we try to go right in between. Nice deep breath. Alrighty. Just gonna go ahead and move down the spine. No pain, No discomfort, no abnormalities near the coccyx or the buttocks.
No.
Alrighty, we'll go ahead and have you sit back up. You can get changed back into your hoodie. Alright, this concludes the end of our assessment. I'm gonna go ahead and get this documented. Anything you need before I go? Do you need to go to the bathroom?
No, I'm good.
Nope. Alrighty. Let me know if you need anything. We're just gonna be right down the hall. It was nice meeting you today.
You too.
Thank you.